Chapter 12, Examination of the Patient. Examination for the purpose of pathological study and for diagnosis are necessary and important in their several fields. But from the standpoint of homeopathic pharmacotherapeutics, their importance is relatively not absolute. The wise physician who recognizes his own personal and technical limitations and judiciously uses the services of others who are specially qualified in some particular branch, specialist who recognizes his limitations. The highest and only mission of the physician is to heal the sick. Prescriber, dealing specifically with the application of medicine to disease according to a definite principle for the purpose of curing such conditions. We must first gain the patient's confidence and relieve him as far as possible from the sense of restraint and embarrassment. We should not confuse the patient by a too penetrating gaze at some object features which may attract our attention. A nervous patient will often be seriously disconnected by so simple a procedure as listening to heart action with stethoscope, sometimes even by taking his pulse. The patient is first encouraged to tell his story freely and relieve his mind, and later on physical examination is to be done. Examination should be conducted in an easy, semi-conversational manner. Results are obtained best from homeopathic standpoint by making him forget that he is under examination. It is a good rule to keep the patient talking, but say little yourself during an examination. We may start him in his narrative by asking him and how his trouble began. We may instruct him to be as definite as possible in relating his history and in locating and describing his sensation as they seem to him. We should not ask leading questions nor put words in his mouth, but let him express his feelings and observation in own way. We analyze, complete, correct, interpret his statements in accordance with principles of homeopathic symptomatology. Leave space between the symptoms as they are written. When the patient has finished his statement, one can glance quickly back over the page, see what has been left out, and write it in. If there is any incomplete symptom, we can ask questions regarding location, sensation, and modality and fill in the records. Keeping records. Page is divided into 3 vertical columns, the first for date and remedy, second for symptom, and third for modalities and conditions. Analyzing. Facts from the patient's statement. Then the nurse's, relatives or friends' statements, and then our own observation. Synthesis. Review and study of the symptoms and construction of the case, classifying symptoms as we generalize. Comparison of the symptoms of the patient with the symptoms of the materia medica in repertory. Finally, the selection of the indicated remedy by the exclusion process, classification of symptoms into general, particular, and common symptoms. Hahnemann devotes 22 paragraphs in the organon to the subject of examination of the patient from paragraph 83 to 105. In paragraph 83, this individualizing examination of a case of a disease demands of the physician nothing but freedom from prejudice and sound senses, attention in observing, and fidelity in tracing the picture of the disease. the prejudice of a materialistic mind of pathological theories which seem too often to be antagonistic to homeopathic principle. Dr. Wills, he witnessed a case for the first time, an examination of a case of phthisis pulmonalis by the old preceptor. The examination process had information regarding character of sputa. He inquired particularly about color, odor, form, and taste. After the patient had been prescribed for the dismissed, he frankly stated the difficulty to the old master, to which he laughed a little sympathetically at the ignorance and pointed out that patient's reply to tasted sweetish had enabled him to differentiate between two similar remedies and make an accurate choice. It concludes the necessity for close analysis of all the elements of the case. Attention should again be directed to use and importance of the logical analysis in the symptomatic examination of the patient. After locating that anatomically, it should be analyzed into its elements of color, odor, consistency, and quality. The trained examiner patiently and skillfully analyzes and completes the statements, brings out details, connects the whole, and constructs the case logically and scientifically. As models of analysis in special diseases for daily practical use, procure and study Allen on intermittent fever, Bell on diarrhea, and Kimball on gonorrhea. In general analysis and synthesis of entire field of materia medica, Bonninghausen, Therapeutic Pocketbook, and Kent's Repertory are classics indispensable to every homeopathist. Bonninghausen, Therapeutic Pocketbook, and his book on fever are original and unsuspected models upon which other reliable works on this class are based. Clinical histories. Getting a good clinical history is one of the most important part of the case taking. In order to deal with present, we must know something of the past. We should get a complete list of possible of the patient's previous disease from the childhood down to the present. Inquire carefully not only as to acute eruptive infection, inflammatory or febrile diseases, including the so-called children's diseases, but about more chronic and obscure ailments including skin diseases, organ and glandular diseases, all disorders of sexual spheres, especially syphilis and gonorrhea. In women and girls, we should inquire about menses, age at which established, and regularity of the periods. Note all deviation from the normal and a certain time and influence of marriage, childbirth, etc. We should inquire if any other inoculations with serums or vaccines have been performed. Many troubles may traced back to vaccination and inoculation, intentional or accidental. The kind of treatment the patient has had for the disease experience and the principal drugs used should be learned if possible. The occupation and habits of the patient, diet, exercise, sleep, use of tea, coffee, tobacco, stimulants should be noted. Important to ascertain whether the patient has met with any accidents or mechanical injuries or has suffered from any mental shock or trial such as grief, fright, anxiety, disappointment of the love, etc. Such expressions have a powerful influences in causing or predisposing to disease. Important to ascertain the family history, brief history of disease, causes of death, predispositions and tendencies to disease and individual peculiarities not only of the patient's brother and sister but his father, mother, uncles, grandparents if possible. General history and should make up a part of the office record of every case. Such an examination should be made not only for its great practical and scientific value but for its psychological influence upon the patient. Printed blank systematically covering the points outlined modified according to the individual judgment and need will seek greatly facilitate the process of good history and case taking. The examiner should be constantly on alert and observing while making an oral examination. Patient may be unconscious or delirious, or an infant unable to talk or insane. Knowledge of the natural history and phenomena of the disease will aid in forming a true picture of the disease. As a prescriber, the homeopathician is always seeking that in case which is peculiar, uncommon, characteristic, individual. In some casual expressions of the patient as he talks, revealing his mood or state of mind or the origin in his trouble, it may found in the color, form and expression of his countenance or in his attitude, gait and physical demeanor. Patient is confined to bed, the examiner will observe his position in bed, his manner of making, moving or turning, his respiration, the state of his skin color or odor of perspiration, odor of exhalations from mouth or body, physical appearance or excretions, relation of the patient's sensation to atmosphere and temperature is showing in a amount of covering, ventilation of the room, ice bags, hot water bags, etc. The mental state, conscious and subconscious, is revealed by the general behavior and conversation, the expression of the continuance, the desire and aversion, and the manner of sleeping, as well as the voluntary expressions. In the matter of mood or temper of the mind, for instance, he will be able to judge from patient's manner of relating or expressing his suffering and his behavior towards his attendants whether he is sad or cheerful, calm or anxious, confident or afraid, indifferent, morose, censorious, malicious, irritable, suspicious, or jealous. As to intellect, he can observe whether the patient is dull, stupid, unconscious, excited, delirious, distracted, confused, etc. All the points are covered by the rubric in a good repertory and helps in selection of the remedy. Every case should be approached with his thought and the mind kept active and alert while talking with the patient and his friends. The physical examination of a patient will be made thoroughly and systematically also, and the finding added to the record. If he succeeded in impressing upon his readers the necessity and advantages of always making thorough and systematic examination and keeping full written records of the cases, the author will feel that his purpose has been accomplished.